Hello, students. In this session, we will look at the face dissection. This image shows the muscles of facial expression after the removal of skin and subcutaneous fat. All the muscles displayed here are responsible not only for facial expressions, but also function as sphincters or dilators around the openings of the face. The frontalis muscle is attached to the epicranial aponeurosis. Around the orbit, the orbital and palpebral parts of the Orbicularis oculi muscle are clearly seen. Between the lateral part of the nose and the medial aspect of the upper lip lies the small, thin levator labii superioris, aliquae nasi muscle. On the lateral part of the nose, the transverse part of the nasalis muscle is visible. The levator labii superioris muscle is also displayed, while the Zygomaticus major and minor are located over the zygomatic region of the face. Surrounding the mouth is the Orbicularis oris muscle. Below the lower lip lies the depressor labii inferioris, and at the lateral angle of the mouth, the depressor anguli oris can be seen. Lateral to this lies the risorius muscle. Deeper in the buccal region is the Buccinator muscle, and on the chin area, the Modiolus muscle can be observed. This image presents a posterior view highlighting the occipitalis muscle and part of the epicranial aponeurosis. The occipital part of the epicranial aponeurosis is clearly visible, with the occipitalis muscle attached to it. The aponeurosis itself is anchored along the highest nuchal line. On either side, the sternocleidomastoid muscle is attached to the mastoid process. The trapezius muscle originates from the medial one-third of the superior nuchal line and the external occipital protuberance. This image displays the buccinator muscle after the removal of several superficial facial muscles, the parotid gland, most of its duct, and the masseter muscle. Buccinator lies deep to the other dilator muscles forming the wall of the cheek. Medial to the buccinator, the medial and lateral pterygoid muscles can be identified. Behind the zygomatic arch, the tendon of the temporalis muscle is visible. The parotid duct is seen piercing the buccinator muscle, and the facial artery is shown crossing the mandible. This image shows the platysma muscle after the removal of the skin. The platysma lies within the superficial fascia of the neck. It originates from the subcutaneous tissue of the infraclavicular and supraclavicular regions and inserts into the base of the mandible, the skin of the cheek and lower lip, the angle of the mouth, and blends with the Orbicularis oris. The cervical branch of the facial nerve emerges from the parotid gland and supplies the platysma muscle. Also visible in the picture is the external jugular vein lying on the sternocleidomastoid muscle. The parotid gland can be seen resting on the masseter muscle. In addition, the risorius and depressor anguli oris muscles are identifiable in this illustration, with the platysma lying slightly lower than usual in its superior aspect.